ACL tears are very common. It's very devastating for a young athlete to find out they have an ACL tear. This always occurs from an injury while playing, but maybe not necessarily a contact injury. For example, in soccer and even a lot of times in football, these are pivoting type injuries where you go to plant and change directions and then you feel that dreaded pop in your knee gives out, you typically aren't able to complete the game, you get significant swelling and stiffness by the next morning. In the office, we see that swelling, but we're also able to examine your ACL and test for laxity. We commonly would get an MRI almost immediately if we're at all concerned for an ACL tear. The ACL is a ligament in the middle of the knee that keeps the bones from shifting on each other, and that's really what we care about. When those bones shift on each other, it can damage the meniscus, lead to meniscus tears, as well as damage the articular cartilage and lead to arthritis. Unfortunately, the ACL is not a ligament that heals. It's not something I can sew together, so we need to reconstruct it and take a graft from somewhere else. In young 20-year-old athletes, we would take your own tendon, your own tissue. In middle-aged adults, you get to be 40 or so, then we start to look at cadaver grafts and allografts. Again, this is a same-day surgery, in and out the same day. We do a nerve block with our anesthesiologist. You're on crutches for a few days, providing there's no meniscus repair that goes along with it, and we start you in therapy almost immediately within 2 to 3, 4 days after surgery. You're back running around 3 months, agility exercises around 4.5, 5 months, but 9 months before you're able to return to full sports, back to the level that you were before your injury.